The South African Health Products Regulatory Authority, SAHPRA, says its investigations so far have found no link of people dying from taking the vaccine. There has been some hesitancy from some quarters of society with fears that the vaccine might make you sick or even worse, result in death. Let's bring in Joan Van Dyk, who is senior health journalist, to talk to us about that particular issue. She is from Bhekisisa at the Center for Journalism, Health Journalism. Joan, thank you for talking to me. So I suppose on matters like these, it's important to tread and run the track of science and the facts as they stand. There were these reports, I think a month ago, that I saw that there were a number of deaths that were being looked into to establish whether they were linked to the vaccine, because the cases had been reported as people who had taken the vaccine but then died. And so they were seeking to see if there was that link or not. In summary, what has this study found now from SAHPRA?
So in the end, what happened after the investigations have happened, there were 53 cases that were investigated. And the outcome of this report is that all of those cases were coincidental, which means they had nothing to do with the COVID vaccine. It's a very complex and very thorough investigation that is done to properly link a COVID vaccine to a death. And in the time that this study was done, it's a tiny percentage. It's 0.007% of people, of these deaths that were reported. And on top of that, none of them could definitively be linked to the COVID vaccine.
And in fact, they break down what the causes of death were, do they not, to explain it and actually give the facts around these people that died, that happened to die coincidentally after they'd taken the vaccine. Are you able to talk to the breakdown?
Yes, so of the 53 cases that were reported, 6 of those people died as a result of COVID infection. But it's important to notice that this is not as a result. The COVID infection didn't happen because they got the vaccine. This is because no COVID vaccine can give you 100% protection against becoming infected. So it's totally possible that you can still become infected with COVID after vaccine. Maybe you were infected unknowingly when you got the vaccine, something like that. The other reasons are people had underlying diseases that they fell ill with that was not related to the vaccine at all. So that's the kind of breakdown that we're seeing at the moment. The other details that we've got is that a quarter of the reports of side effects are coming from Gauteng, and the next highest number coming from KwaZulu-Natal. I don't think that's got anything more to do than just the number of people that live in those provinces. And in general, all across the world, because monitoring side effects happens passively, so it depends on individual people who get the vaccine and to actually go and tell the regulators that they're experiencing some severe side effects. They're underreported all around the world, but still very few, 0.02% of people who have gotten the jab in South Africa have reported any kind of reaction afterwards.
And are we getting a glimpse, Joan, into how serious the reaction or what they call adverse events or side effects, how serious, they are, and what the proportion is of those who have, a sore arm, which is something that we all have after taking the vaccine, as feelings of, feeling a bit feverish here and there, headaches here and there for a few hours, and then everything is fine. From that to people who actually feel like, I'm sick and I need to report this to the authorities and perhaps even get attended to.
So people are reporting mostly they're reporting these mild side effects, fevers, pains, chills, all those things that we experienced after the vaccine. But the only severe side effects that there was any kind of breakdown on in this report was from the deaths. The more severe side effects that could also come up in future is something that would possibly get you into hospital, like a severe allergic reaction, anaphylactic shock, that kind of thing, or something that would prolong a hospital stay. Those are the kind of severe side effects that would then be investigated to see if they are linked to the vaccine. If someone's going to the MedSafety app and they're reporting a headache or a fever, that is not going to be investigated at length. To link a death or severe side effect to a vaccine is a very long and complicated process. So they won't be investigating those mild side effects.
And tell me a bit more about this MedSafety app. I don't think we've done enough reporting on it, I must say. But it is an important tool, is it not, in terms of being able to track what happens once a person has received their jab or, complete vaccination, for us to get a clearer picture of what the situation is in terms of the health impact or any adverse reactions that are reported. How useful is it and how is it coordinated?
So the MedSafety app is an incredibly important tool, and it's something that is being underused. Not many people have downloaded it from SAHPRA's data that they've showed us. Not enough people are basically using it, and it's so important. Not only the severe things that you then know about and can investigate, but also just to see how this vaccine is how people are reacting to this vaccine in the population. And also what's very important is when people are logging their report through this MedSafety app, they're not including enough information, which means that if there's cause for investigation by the health department and by the special committee that investigates causality, it takes them so long to get back to that person because they don't have all the information that the app asks for in their report of a severe side effect. In the most severe cases, for example, if there's not a post-mortem report if you want to have investigated whether a death is linked to the vaccine, then that investigation can't go any further if there is no post-mortem report or lab results that they could work from. So at this point, they are encouraging more people to use the app so they can get a better sense of what's happening around the country.
So lastly then, Joan, as we have a situation now that government has decided that all adults over the age of 18 should get the vaccine now, 18 to 34 being that group that now just recently are starting to register and go and get their jabs. Settle this for me once and for all then, and perhaps highlight once again, you are saying to me, as people are going through a sense of trepidation, wondering, should I not get it? I don't know enough about these vaccines, previous vaccines that I've done research on. I've found that they are developed over a number of years, but these ones were done so rapidly. How can I trust it? What are going to be the effects on my fertility, on whether or not I continue to function properly, sexually, etc., etc. Settle it for me once and for all. What should be the reaction of people in that position? The 18 to 34s, the 35-year-olds to, 49, and the rest of the age groups?
Well, it is true that these vaccines have been developed at an incredible pace, but it has also gone through very stringent regulatory approval from our own medicines regulator. You can absolutely trust that it's a very, very thorough process, and that any adverse events that are happening are being tracked. And it's kind of if you think of the vaccine as a kind of social good, like you're in a social contract with the rest of your peers that you want to keep yourself safe, we're keeping each other safe. And if you've kind of agreed to go that route, there is recourse for you if you're one of the incredibly rare people that do experience some kind of injury from a vaccine. It is so incredibly rare, just to be clear, it's less than 1 in a million people from the J&J vaccine, for example. But if you are the less than 1 in a million people, there is also recourse for you. You can lay a claim with the vaccine injury scheme. But I would not, there's no link for the vaccine and any reproductive health issues. It won't affect your fertility. The only kind of side effects most people can expect is a bit of a fever, maybe a bit of feeling a little bit tired, but it should pass in 1 or 2 days.
And Joan, you're not just saying this because you and I are part of the big conspiracy with Big Pharma and other dark forces. I've taken the jab myself. I'm still alive.
No, I've also been lucky to have the jab through the media program. And I'm doing well. Had very mild,
Thank you.
Mild side effects.
Yeah, I make light of it, Joan, though, but, I'm trying to sort of drive home the point that the work that you do as Bhekisisa and other health journalists in the country is absolutely crucial, because some of the trepidation is people really not understanding the facts as they stand in the science. And of course, you have the other extreme, which is the anti-vax campaign and lobby. But it's important for people to be able to navigate those difficult spaces as easily as possible and as clearly as possible. Joan Van Dyk, thank you so much for your time. She's from Bhekisisa Center for Health Journalism there, just talking about the study that has come through from SAPRA that says at this point there are absolutely no deaths that have been proven to be linked to someone taking the COVID-19 vaccine, be it J&J, be it Pfizer, any of the vaccines we've used, no deaths. They've investigated 53 deaths that were initially investigated, people who had had a vaccine and then died, and they found various causes of death which had nothing to do with them being killed by the vaccine. It's absolutely important. Follow the science.